without you guys, so hang in there. We're really very grateful. So we're going to start with 489. Oh, there's one withdrawal. Is there a motion? So moved. Is there anyone opposed to it? All right, all those in favor say aye. Aye. Any objection? Seeing none, let's start with 489. Because some people have to leave, and if they leave, then I vote on the others. Let's do 489. Residential Service Agencies Reimbursement Personal Assistance Service. That's Lisa and Rosenberg.
This bill specifies that the Maryland Department of Health may reimburse a residential service agency for personal assistance services only if the services are provided by an individual classified as an employee. There is an amendment, I haven't figured out what page it's on yet, that changes the enactment date to October 1st, 2024.
Delegate Rosenberg.
It's on page 5, if you're curious.
It was the consensus of the subcommittee that being considered an employee instead of an independent agent was to the benefit of the employees. This is, be straight up, this is a bill pushed by 1199E. And I would also add that this bill would put us consistent with what is Labor Department policy.
Okay. And are there amendments? Yes. Do you want to move them, Delegate? It's been moved.
Thank you, Madam Chair. Move the amendment.
It's been moved in second. Thank you. Let's open it up for discussion. Delegate Shalega.
So I don't know what are the amendments here before us? Page 5. Page 5.
I'm sorry? Page 5, one amendment that changes the enacted date.
Okay. So,
yes.
So it's the Department of Health can only reimburse a residential service agency if the employee's in a union? Is that what it says?
No, if the...
What does it say? That's what it sounded like you said.
I said they support the bill. Labor supports the bill, and it was our view as a subcommittee that it was in the best interest of the individual worker to be considered an employee instead of an independent agent.
So the Department of the Health can no longer reimburse services for independent contractors. So if you wanted to start your own personal assistance service, you could not get reimbursed because you would not be an employee.
Because it was of significant benefit to the individual worker to be classified as a worker instead of an independent
Okay,
agent.
just to be clear though, what you're doing is removing the opportunity for people to start their own business within this sector. Because when you start your own business, you're not an employee. You would be a K-1, you know, it's a different strata when you own your own business. So just as long as you're clear, that's what you want to do. I'm going to vote against it, but thank you.
Delegate Chisholm.
Thank you, Madam Chair. If I recall, and I've actually talked to some individuals like the flexibility of being a 1099 employee. It wasn't that all employees felt like they'd be better off, because if they felt like they'd be better off, there was plenty of different options out there for them to become W-2 employees rather than 1099. The 1099 gave them more flexibility from the testimony they gave both last year and this year. And obviously, we also had an advocate against the bill, who I think he has 150 different small residential agencies. So when we say things like we feel like it's better for the employee, we're maybe the vast majority or a majority of the employees, but not all employees, for the record. So that's my opinion of what the testimony brought out.
Thank you. Thank you, Delegate. Vice Chair Collison.
Thank you, Madam Chair, and thank you for explaining your concerns with this bill. I guess I look at it in terms of there is still an opportunity for people to be private consultants, 1099s, and work on a 1099. But the difference is this bill would say
Medicaid in those situations where they're working in residential settings would have to be, in order to receive the Medicaid reimbursement, they would have to have employees and not 1099s. And I think I've actually been a 1099 employee, so I understand how complex it is. And believe me, I stopped doing it because it put me at a lot more financial risk at being a consultant than it did being an employee. Certainly, if I were an entrepreneur and wanted to, start a business, then that might be the best option for me. That wasn't my experience, though. And the folks who work in residential settings are making very small amounts of money. It's probably just a tiny bit over the minimum wage, whatever the minimum wage is at this moment in time. I know that we're edging up towards 15, but I don't think we're there yet. I think in order to get staffing, some of these settings pay their employees a little bit more than the minimum wage, but it's still minimum wage. And most of them are working 2 jobs because they can't, if they're 1099 employees, they can't afford health insurance. They're struggling making ends meet in terms of housing. As employees, your salary is predictable, your income is predictable, and where your tax status is, and so it's a much more comfortable place for I don't mean comfort in terms of physical comfort, I mean economic comfort for someone who's making, $13 an hour, to know that they have a steady income and that their taxes, they're going to know exactly how much is going to get in their check every 2 weeks. So that's why I would support the bill.
Thank you. I saw Delegate Hill, followed by Bandari, followed by Lewis.
Yeah, thank you. I just wanted to
Johnson.
clarify, and I know Delegate Shalega and Chisholm know this, and you may know it actually more than I do, but a lot of times employees think that a 1099 is a choice, that you say, how do I want to get paid? But actually, the federal guidelines look at more, it's not about how you get paid, it's about how much autonomy you have and how much freedom you have and whether you have a fixed schedule, whether you control your schedule and all those things. It's not a matter of whether you get paid with benefits or the other. And that's why we've had so much problem, is that many employers think that is how I want to pay you when the federal guidelines say it's not. And I've had the experience of thinking I had contracted with 1099s for my massage therapist and my esthetician, only to find out they couldn't be 1099s because I needed to give them other things like a key to the business and some, I had to give them other things and let them control their schedule, as opposed to me putting them on the schedule when I had a client or a patient I needed them to see. So I just wanted to throw that out there, not as a pushback, because I get you that it should be a choice, but I think that it's not as much a choice as we think it is, and that most employers, if that's what they want to do, they can craft it, but it's not going to be just how do you want to get paid, it's going to be how much independence do I give you in terms of am I making your schedule, or are you making your schedule? Not do you have the right to say you won't accept an assignment. That's not 1099 defining. Thank you. And I could be wrong, but that's my understanding.
Thank you. I have Delegate Bandari. I'm going to, if you can hold on 1 second, Delegate Bandari.
Yeah, thank you, Madam Chair. Actually, I feel like this bill will equally help residential service agency, RSAs, as well. Like misclassifying PSAs as independent contractors denies them important legal protections and can also result in costly investigation and litigation for those RSAs. So I think this is a very good bill.
All right, I'm going to call it in the order I see it, just to be fair to everyone. I saw Delegate Johnson, then Lewis, then Shalega. Okay?
Thank you, Madam Chair.
Thank you.
In the hearing, I heard a contractor that had a contract and then paying his employees as 1099 employees. And I heard him say they loved the flexibility, but I didn't see any of them show up to testify. I did, however, hear some 1099 employees that had issues with being paid as a 1099 and would like to be considered an employee. When you're a contractor and you have a contract, but then you make your employees 1099 employees, you know, you skirt a lot of issues like workers' comp, with tax withholding, Social Security. And the employees are expected to handle all that. And like Delegate Collison said, that's a lot to keep track of your taxes and then get hit with a big tax bill at the end of the year to make sure that you're paying all the proper Social Security and Medicare. That's a huge undertaking. And for these folks that are not making much money at all, that is really not fair to put that on them or to lead them down the path to think that that's going to be better for them. And I've heard employers tell employees that they want to pay as a 1099, oh, you can do all kinds of tax deductions, so you'll come out ahead. Rarely do they come out ahead. Thank you, Madam
My
Chair.
pleasure. Delegate Lewis, then Shalega.
Thank you, Madam Chair.
You're welcome.
And thank you to my subcommittee chair for the great explanation. I think one other important factor to consider about the need for this bill is that the Maryland Department of Health has asked for us to do this. And I think, if nothing else, part of our goal in tackling the workforce, the healthcare workforce shortage, is to enable the Department of Health to deliver for the people of Maryland as it should, and they're asking for this measure, so I feel confident in supporting it. And I think it's also really important to remember that the state has an interest in how public funds are used, and all this bill does is to say that state Medicaid dollars can only be used to pay people who are employees. And for that reason, I'll be, well, obviously as a sponsor, I kind of gave it away, but I'll be supporting. And I do thank you, Madam Chair.
Thank you for those comments. Delegate Shalega, followed by Bagnell.
Thank you. I just would like to clarify what Delegate Hill said. So as an employer and a business owner, you have to pass the ABC test, and you can Google that. I'll let you look that up. But I, as an employer, when I have 1099 employees, or they're not employees, when I have 1099 subcontractors, every year I get audited by my workers' compensation insurance company. Anyone who is a 1099 subcontractor for me, I have to provide a certificate of insurance that proves to my insurance company that that person has workers' compensation and general liability insurance. And if they do not, I have to pay for it. So just so you know, this isn't willy-nilly out there in the employment world, and people are picking and choosing. If you get audited as a business on these 1099s, you do get audited annually by your insurance company. But if the Department of Labor came in and audited you, because we had a big push on this with unemployment to make sure that businesses weren't skirting this. When unemployment was underwater, gosh, what was that, 6 or 7 years ago? So, you know, to Delegate Hill's point, this isn't a, you know, willy-nilly kind of thing that goes on. That if you do this as a business, it is regulated. Thank you.
Thank you. Delegate Bagnell.
Thank you, Madam Chair. And I just want to make sure we're not conflating the conversation when we're talking about autonomy and when we're talking about flexibility. Because you can be a W-2 employee and still be flexible. It's really about the negotiation you have with your employer. I'm a W-2 employee for a summer camp. It doesn't mandate hours. It just means that you have to negotiate that your hours. You have less autonomy. And I think it's important that we be clear when we're talking about that your hours aren't restricted because you're an employee. It just is that you are having that negotiation with your employer as opposed to setting your own hours. But as an employee, as a W-2 employee, you also have, you do have benefits that are important. And by not having, you know, a number of 1099s, it does make tax time a little easier because you are not trying to track all of that. information. You do have benefits, you do have some protections, and I think when we're talking about state dollars, which is what we're talking about, Medicaid dollars, and when we are talking about a bill that basically codifies a guidance document that requested that we do this, I think there is a lot of value in doing this, because it also is going to help stabilize these facilities, because they aren't going to have the same rate of turnover, because they are going to be incentivizing their employees to stay in those facilities. Thank you.
Okay, so I know that some people have to leave. I'm going to let Delegate Chisholm go ahead and ask a question, but please keep in mind that we have a lot and we have to be on the floor at 10, okay? No, go ahead.
Hard for me to comprehend how you help in a labor shortage by making it more difficult for an employee to hire people. That's all I'm going to say. I'm all for the option of letting them have the option. When you make it more difficult for an employer to hire somebody, you're going to create a bigger labor shortage. Thank you, Madam Chair.
Okay, thank you. And I want to thank all of you for having a wonderful civil discussion. And we know that as Sue Krebs, if you're watching, philosophical differences, okay? And we miss you here, philosophical differences, but I love the dialogue, though. And, like everything, there's views on both sides, and I thank you for feeling comfortable for having it here, very much so. So on the amendments, we had the discussion. All those in favor say aye. Aye. Any opposition to the amendments? Seeing none on the bill as amended, is there a motion? Move the bill as amended. It's been moved in second. Is there discussion? Seeing none, all those in favor say aye. Aye. Any opposition to the bill, can you raise your hand? Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, and Delegate Hutchinson. Okay, thank you. And thank you so much for the discussion. So let's move through these. We have House Bill 103. And that is State Board of Social Work Examiners, temporary license to practice social work. Lisa and Rosenberg.
As introduced, this bill requires the State Board of Social Work Examiners under specified circumstances to issue a temporary license to an applicant who, except for passing the required examination, has otherwise completed the education and experience requirements for a license to practice bachelor or master social work. The board must issue a temporary license if an administrative delay prevents a required exam from being available to an applicant. The temporary license is valid until 180 days after the exam becomes readily available. And a temporary license authorizes the holder to practice bachelor or master social work in the state only under the supervision of a board-approved supervisor. There are amendments on the first page of your packet. That amendment number 1 is technical. Amendment 2 provides that temporary licenses may only be issued if the exam is unavailable for 15 rather than 7 days. It authorizes rather than requires the board to issue the temporary licenses under specified circumstances, and it requires the board to submit an annual report on whether the exam became unavailable, and if it became unavailable, whether the board issued temporary licenses and other specified information.
Wonderful. It's been moved in second. Although, any discussion or concerns? All those in favor say aye. Aye. Any objection on the bill as amended? Move the bill. It's been moved in second. It's been moved in second. Any discussion or concern? All those in favor say aye. Aye. Any objection? Is there someone that doesn't want to be on the bill? All on the bill. All right. House Bill 178. All right. And for people watching at home, we have read the bills, we have studied them, okay? And we know them. All right. It's been no amendments, moved in second. Any concerns or questions? All those in favor say aye. Aye. Any objection? House Bill 271. It's been moved in second. Any questions or concern? All those in favor say aye. Aye. Any objection? The bill passes. House Bill 318. We did 271. There were no amendments on it. We did it. So let's go to 318. 318 is the Maryland Medical Assistance.
The bill requires a provider agency to submit to the Department of Labor a specified cost report that includes documentation of the provider agency's average wage rate for personal care aides and requires the Department of Health to update a certain report and develop a plan to close any identified differential gap in reimbursement rates. There are amendments in your packet that strike the requirement for the Department of Health to increase the reimbursement rate for personal assistance services or for a provider agency, and strike the authority of the department to take certain enforcement actions against a provider agency.
Delegate Bagnell.
These were consensus amendments that get us the data that we need to actually do reasonable rate setting. It was unanimous, move the amendments.
It's been moved in second. Any discussion? Who is it? Any discussion on House Bill 318 from anyone, all right? Seeing none, all those in favor say aye. Aye. Any objection on the bill as amended? Is there a second? Is there any concern on House Bill 318 from anyone here? Seeing none, all those in favor say aye. Aye. Any opposition? Who does not want to be on the bill? Delegate Shalega, Delegate Riley. Thank you. House Bill 370 it's been moved in second. Any concerns regarding this bill? Any discussion? Seeing none, all those in favor say aye. Aye. Any objection? Seeing none, let's move on to 374. I'm sorry, I apologize. No, we did that already. We are right now on House Bill 374. You cannot be on it. We did already. We did it. 1 second. Guys, 318, I did ask who does not want to be on it. No one raised their hand. Oh, no, I'm sorry. It was Shalega and Riley, the only ones that do not want to be on it. All right, so we did do 370, and that was favorable. No one can go on it because it's favorable. Now we're on 374. Lisa.
This bill expands
It's okay.
the applicability of specified requirements governing pharmacy audits to all pharmacy benefit managers and requires the Maryland Department of Health to adopt regulations establishing a pharmacy audit process for pharmacy benefit managers that contract with managed care organizations that is substantially similar. The bill also authorizes PBMs to conduct an audit through an auditing entity and the insurance commissioner to adopt regulations, and imposes additional requirements and restrictions on PBMs during the audit process. There are amendments in your packet that start on, why are they not here? Okay. Well, it's like.
This is
not in order.
teamwork. Thank you very much.
Anyway.
Page 11.
Okay, so Amendment 1 is technical. Amendment number 2 strikes language requiring an auditing entity to register with MIA. It strikes language regarding a time period for validation invoices and clarifies that a PBM conducting an audit must accept a completed cash register transaction as proof of delivery or pickup unless there is contradictory information. Amendment 3 prohibits a PBM from recouping funds or charging fees with regard to an incorrect day of supply if the package size is unbreakable and the PBM cannot accept the day's supply during adjudication. It specifies a PBM may not have access to a pharmacy's bank, credit, care, or depository statements of data as it relates to cost sharing. It specifies a PBM cannot audit claims that were reversed or for which there was no money paid by the purchaser or cost to the customer except if the audit is necessary to evaluate compliance to a contract. It increases the number of prescriptions that may be audited from 50 to 125, and it strikes language that would have required PBMs to pay pharmacies for audits. Amendment number 4 strikes language requiring final audits to include specified information, authorizes a PBM to use a secure portal in addition to a phone to address inquiries about an audit, requires inquiries to be responded to within 3 business days, and requires PBMs to provide a mechanism for secure electronic communications and document submission. The Amendment 4 also establishes applicability provisions and changes the enactment date to January 1st, 2024.
Delegate Collison.
Chair, with these amendments were worked on together with the representatives of the pharmacy benefit managers and independent pharmacists. They worked very hard to try to get to language that they could, while they might not be waving flags and supporting on either side, they agreed that this is a much better process and it is a stronger regulation of the audit processes to the favor of the independent pharmacists. With that, I move the amendments.
They've been moved in second. Any discussion or concerns on the amendments? All those in favor say aye. Any objections? Seeing none on the bill as amended. The bill is amended. It's been moved in second. Any questions or concerns? All those in favor say aye. Any objection? Who doesn't want to be on the bill? Everyone is on the bill. And I want to take a minute to say thank you for working it. And for those of you that were the opposition, if you're watching, please don't kill it in the Senate, because we'll be back next year. Okay? Thank you. Let's move on to the next one, House Bill 614. And that is Lisa, Department of Aging, Dementia Care Navigation Programs.
This bill requires each area agency on aging to establish a dementia care navigation program. The Maryland Department of Aging must oversee and train dementia care navigation program staff and disseminate best practices and collect interaction data to ensure statewide program integrity. By October 1st, 2024, and annually, the Department of Aging must submit a report on dementia care navigation services and publish the report on their website. The amendments make technical changes. They renamed the program the Long-Term Care and Dementia Care Navigation Program and make conforming changes. They clarify that under the program, the program will conduct cognitive screening rather than assessments. Specifies that each area agency will develop a program and implement the program subject to the limitation of funding. Provides that it adds providing information and referrals to long-term care services to the duties of the program and alters the formula for funding.
Yes. Thank you very much. Any concerns about the amendments? Seeing none, all those in favor say, oh, there was a...
Just quick questions. I got to go by my notes because I'm not in the group. MoCo said the funding was inadequate and in the program, as a navigator program, is unproven, and they wanted it to be voluntary participation. We did not do that. How do we respond?
The amendments are acceptable to them, and the annual report will give us the opportunity for all the parties involved to bring this issue to our attention again every year, if needed, in subsequent years.
Okay, thank you. And then the two other question was, why did we decide to just keep this a dementia and dementia caregiver navigator and not broadly? We've got a lot of people who are helping, who are caregivers. So why is this not a caregiver navigation program? Why is it specific to dementia?
I think to address this specific problem, and if we learn from this, we can apply it elsewhere.
We can broaden it later on if it seems to work, okay?
In the annual report.
All right, and then respite care may be at the heart of our problem. And it looks like this doesn't do researching this or access available resources. That was the Alzheimer's Association's issue.
Everyone's agreed to the compromise.
All right, thank you,
Thank
Madam
you.
Chair.
Thank you for the questions.
Thank you.
Yes.
The amendments do actually expand it a little bit so that it will now apply to dementia and long-term care.
Thank you. Okay, good.
Thank you very much. For the floor leader, it applies to what? Dementia and long-term care, and you'll know who you are in a minute. Just, okay. I was looking to my left. Okay, so on the amendments, all those in favor say aye. Aye. Any opposed? On the bill as amended? Move the bill as amended. It's been moved in second. Any concerns or questions? Seeing none, all those in favor say aye. Aye. Any opposition? Who does not want to be on the bill? Everyone wants to be on it, great. Let's go on to 785, Lisa.
So House Bill 785 requires carriers, including those that provide prescription drug coverage through a pharmacy benefits manager, to establish a process for requesting an exception to a step therapy or fail first protocol that is clearly described, easily accessible to the prescriber, and posted on the carrier's or PBM's website. A step therapy exception request must be granted under specified circumstances, and an insured or enrollee may appeal the denial of a step therapy exception request. A carrier or PBM may use an existing step therapy exception process that satisfies the requirements of the bills. The amendments strike language prohibiting step therapy or fail first protocol for specified prescription drugs used to treat specified mental disorders or conditions. They clarify that the exception process only requires documentation if needed. Strikes language regarding timeframes for making determinations for step therapy exception requests. Requires carriers to authorize coverage for a prescription drug when an exception request is granted. And specify that the step therapy exception request process established by the bill does not require coverage for a prescription drug that is not covered by the carrier. The amendments also prohibit more than one prior authorization for 2 or more tablets of different dosage strengths that are prescribed at the same time and manufactured by the same manufacturer, except for specified opioid dosages, and requires a private review agent to make a determination on a request for a step therapy exception or prior authorization of a pharmaceutical service that is submitted electronically in real time as specified or within 1 business day after receiving all of the information necessary to make the determination.
Delegate Collison.
Thank you, Madam Chair. This is another one where the parties started out very, 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 very far apart, and we got them closer, and in the end, this was a bill they thought they could move forward with. I do need to say on the record that the issue related to the medications for mental health disorders is not being erased. It is being subsumed in the study that we are going to look at over the summer with regard to prior authorization and utilization review. So we felt that it needed much more study before we could actually put it in this bill. And with these amendments, all of the parties agreed that they could support it. So I'd move the amendments.
Is it moved in second? Any questions or concerns? Delegate Hill.
Thank you, and thank you, Madam Chair, Madam Vice Chair. Obviously, this is an issue we've been carrying for a while, so simple question. Do the providers have to do more things to get what they need? In other words, do they have to request the exception, sign a form, do more steps, or are they able to practice and with rare exceptions have to justify, not going through steps? It's the burden on the providers. Has that gotten less through this?
If you ask the carriers. Yes. Yes, it did. I mean, did it eliminate it? No. But, so there were still notifications and, and the provider will still need to check to see if medicines are on formularies. But the process itself, I think we streamlined a bit, and I suspect we're going to be working on it more over the summer.
Okay, and the providers are not reimbursing the insurers are not reimbursing the providers for all that extra time that they have to spend to go through it,
No,
right?
no,
Okay,
it's
thank
part
you.
of the original reimbursement, right.
Any other questions or concerns? Okay, was that the amendments?
Yeah.
On the bill? Move the bill as amended. All those in favor? There is any objection to it? All those in favor say aye. Any opposition? Who does not want to be on the bill? Can you raise your hand? All right, thank you. Moving on, before we do that, Delegate Alston is yes on all the bills that we have done so far. Right. 870. All right. Any concerns or questions about 870? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, we're moving on to 967. Second. Any concerns about 967, which we passed last year? Yes, we're gonna try to help him. We're gonna help him. All those in favor say aye. Any opposition? Seeing none, let's move on to 1141.
As introduced, this bill prohibited the installation and maintenance of the social media application TikTok on any information technology owned by a unit of state government. The prohibition does not apply when used for law enforcement activities, protecting national security, or research on security practices. By December 31st, 2023, the Department of Budget and Management, in collaboration with the Department of Information Technology, must publish guidelines to assist units of state government with the prohibition. There are a reprint of the bill showing amendments that begin on page 17 of your packet that prohibit an employee or agent of a unit or an entity contracting with a unit from downloading or using any application, including TikTok or WeChat, or accessing any website that is developed by ByteDance Limited or Tencent Holdings Limited on any information technology owned or leased by the unit, or while connected to any wired or wireless internet network owned, operated, or maintained by the state, and defines ByteDance and Tencent Holdings to include successor companies and entities.
All right, Delegate Kerr. We're gonna introduce them in a minute. Let's finish this bill while they sit.
Thank you.
Thank you.
Madam Chair. This bill came together nicely once everyone had a chance to consider it and what its actual scope was, and I move the amendments.
All right. Second. Moved in second. Any concerns or questions about the amendments? All right, well, let's take the vote. All those in favor say aye. Aye. Any objection? On the bill. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any objection? Who does not want to be on the bill? Martinez, Shalega, Kaiser. All right. So I want to welcome Delegate Lewis. Will you welcome your guest? Delegate Tavares, and Delegate Lopez doesn't want to be on it. Okay, so let's do it again. 1 second, 1 minute.
Not Martinez, Kaiser, Tavares, Lopez.
On TikTok.
I said I have not Martinez, Kaiser, Tavares, Lopez. Everybody else who's here
Is on it.
So also, because Delegate Kipke is absent, he won't be on it either.
Okay, great. So we're almost done. Delegate Lewis, please make the introduction. Thank you.
Madam Chair, Madam Vice Chair, esteemed colleagues, I hope you'll join me in welcoming Girl Scout Troop 4117 for Baltimore City's District 46. We have Girl Scouts. I think we have the little bunnies. What do they call them? Daisies and brownies. I was myself a brownie and a Girl Scout back when I began. Thank you for coming. We have to be real quiet. And we're almost done.
And we want to welcome you. Thank you for being with us today. It's an honor to have you in our house, okay? Did you bring us any cookies? Okay, just kidding. Just kidding. Okay. Thank you. We have House Bill 1148, Aaron and Bagnall.
This bill establishes a Commission on Behavioral Health Care Treatment and Access, creates a Behavioral Health Care Coordination Value-Based Purchasing Pilot Program, extends for 2 years provisions relating to telehealth services, and requires the Maryland Department of Health to apply for certain federal planning grant funds in fiscal year 2025 and for inclusion in a certified community behavioral health clinic demonstration program for fiscal year 2026. There are amendments in your packet that start on page 20 that were adopted in Public Health and Minority Health Disparities Subcommittee. The amendments add members to the Commission, expand the duties of the Commission, clarify that recommendations made by the Commission must be consistent with the Commission's purpose. It repeals the requirement that MDH submit a state plan amendment to establish certain community behavioral health clinics and requires the Maryland Healthcare Commission to conduct a certain study regarding the delivery of health care services through telehealth.
Delegate Bagnall.
This was consensus. This was, I just want to thank Aaron and all the stakeholders and the subcommittee, because they worked really hard on this bill. I think we have a product that we can be very, very proud of, and I would move the amendments.
Any discussion on the amendments? All those in favor, say aye. Aye. Any objection? And the bill is amended.
Move the bill as amended.
It's been moved in second. Any discussion or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Who does not want to be on the bill? All right. Delegate Shalega. Okay. Let's move on to 1153. That's Aaron and Bagnell.
This bill requires the Maryland Department of Health to adopt regulations that establish food service facility standards that are appropriate to certain residential programs that have fewer than 17 residents and have certain licensure. There are amendments in your packet that were adopted in the Public Health and Minority Health Disparities Subcommittee that strike the prohibition on requiring residential programs to comply with certain regulations and instead requires the department to adopt regulations that establish food service facility standards for the specified programs.
Moved in second. Any discussion or concerns? All those in favor say aye. Any objection? And the bill is amended. It's been moved in second. Any discussion or concerns? Seeing none, all those in favor say aye. Any objection? Who doesn't want to be on the bill? Are you kidding me? I know. We'll do that next year. How's that? House Bill 1176.
This is the 911 registry bill that was held last voting session. The amendments that begin on page 43 in your packet alter terminology used in the bill, specifies that a public guardian appointed by the court may not register an individual in the 911 registry program, requires each registrant to annually confirm whether they shall remain on the registry and that their information is correct, requires a registrant who does not update or validate information after 1 year to be removed from the registry, specifies that nothing in the bill may be construed to create a private cause of action, and specifies that noncompliance with information in the registry is not admissible in a suit seeking to impose civil liability arising out of a 911 call. Additionally, in the last voting session, an amendment was added that begins on page 47 in your packet that requires a report on or before December 1st, 2028 to this committee and to the Senate Finance Committee from the Maryland 911 Board. That report would include the number of individuals registered in the 911 registry program in each county for each of the previous 5 fiscal years, the number of program registrants who confirm information necessary to remain registered each fiscal year, again by county, aggregated feedback received by the board from local jurisdictions, local 911 call centers, or first responders regarding the program, and this one came from me, recommended changes to improve the effectiveness of the program, if any.
All right, and Delegate Shalega, I want to thank you for your suggestions. It makes it a stronger bill. Thank you very much. Any discussion on the amendments? Okay, so it's been moved in second. Any discussion or concerns? No, on the amendments. Okay, all those in favor say aye. Aye. Any opposition? Seeing none, on the bill as amended, is there a motion? Is there a second? Discussion, Delegate Hutchinson.
Okay, I held this, and I'm glad I did, but this is more informational for everybody. I contacted Clay Stamp last night, who is the chair of the state EMS board and also the Talbot County manager. He was not aware of this bill and was not supportive of this bill. I talked to Lenny Pfeffer, who is the Dorchester County president, firefighter, and responsible for our 911 center. He was not in favor of this bill, did not know about this bill. This morning I talked to Jack Markey, who is the emergency manager director of Frederick County, and he spoke in that capacity, not his capacity as the director of the 911 board. He is not in favor of this bill. Senator Kagan, who is the state Senate liaison on the 911 board, didn't even know this bill was here. And it seems that this is a bill that has good intentions, but it's one that Jack Markey said, you know, this is something that we could easily be worked out in a work session over the summer and put into our protocols. My counsel was, Tom, this is something that's a burden to us. It's a great intention. It could be a liability if we pulled up to the scene with sirens on and it was a volunteer firefighter. Where does that put us into jeopardy? I know it's got 2 pretty powerful sponsors on it, and it was here last year, and this committee actually voted on it, but it was withdrawn by the sponsors. I just wish I knew a lot more about it, but to think that our 911 board isn't really in favor of it and doesn't know about it is concerning to me. So I share that with the committee.
No, thank you for sharing it. Any concerns or comments? We appreciate it. Delegate Hill.
Well, I served in the final year. I know former Delegate Krebs served for all 3 years on the 911, Next Gen 911 Commission, and I had kind of looked at this. I didn't even think about calling folks, but I thought it was a good idea I am interested in what their objections were, and I do think since we had a commission that looks at those things, that, you know, at least hearing what Senator Kagan has to say. So, I mean, I think there are a couple of options. We pass it, which is what we're set to do, and let them deal with it, or not, right?
So basically, this is what I propose, because we came already to this moment. And there's some jurisdictions that are already doing it anyway, and some may agree, right? There's 23 counties in Baltimore City, 24 different jurisdictions. Some do, some do not. There's some that do support it. Given that, I say we pass it, and across the street, if they'll have a chance to be heard, and they should show up across the street. Okay?
Well, I mean, some jurisdictions are already doing
There's some are doing it already. Yeah, yeah, but they have a chance across the street, and let them know that, you know, they're welcome to go across the street. And that's why we have two houses, right? And a balance, but some are already doing it, and we committed already this far. So I say we take the vote and we let the process work itself across the street. But thank you for letting me know, and I welcome that, because that's important information. Thank you for being diligent. Appreciate it. The bill has been moved and second. All those in favor say aye. Any opposition? I have Delegate Shalega and Delegate Riley and Delegate Hutchinson.
Because I think we should send a message with the bill that we were not unanimous.
All right, thank you. And does anyone not want to be on the bill? Delegate Shalega, Delegate Chisholm, Delegate Morgan, and Delegate Riley, and Delegate Hutchinson. Let's move on quickly to 1244. And that is Lindsay.
This bill requires the governor to annually proclaim January 27th as Maryland Holocaust Remembrance Day. There are amendments in your packet that this bill is actually not voted in subcommittee. The first, in the preamble of the bill, there's a list of people who died in the Holocaust, and so the First Amendment suggests adding Polish people to that list. The Second Amendment would change the effective date of the bill to from October 1st to July 1st.
Okay, any discussion on the bill? Is it actually there amendments, so is there a motion? It's been second. Any discussion or concerns on the amendments? Seeing none, Delegate Rosenberg.
The issue of being very frank, the adding the Poles raises a serious concern. There are Poles, look, I've been to Auschwitz and saw there is a whole corridor of photographs of Polish heroes who were exterminated at Auschwitz. So I know that there were serious losses among the Polish people, but there were also a significant number of Polish people who were made possible the Holocaust. And this language would create real problems for the bill.
Delegate
I would-
Shalega. I'm calling the
Okay.
Speaker's office that we're going to be a little late. Delegate Shalega.
Thank you, Madam Speaker. And actually, Delegate Rosenberg, that's not true. And you're getting your history from a movie that wasn't true. I also visited Auschwitz and I went to Poland. The first shots fired in World War II were in Gdansk. The first place the Nazis went was Poland. There were, of course, 6 million Jews murdered in World War II. There were 1.8 million Poles. There is a plaque in Auschwitz that says that the Nazis wanted to exterminate the Poles, the Jews, and the Gypsies. In this bill, we have inserted Poles in this line. Millions of others, including Roma. The Romas were killed between 250 and 500,000, which is tragic, but not compared to 1.8 million Poles. And that does not include the Jewish Poles. There were many, many Jews who lived in Poland who were killed. So inserting it in Roma, people with disabilities, LGBTQ, Jehovah's Witnesses, political dissidents. It makes sense there. If you were just going to separate it out and put it somewhere else, I might agree with you. But, there were many other, there were Jewish people that turned on Jews. So, I think, with all due respect, you cannot rewrite history, and it is well known. There's a whole wall in the Holocaust Museum to the Poles. So, I would say, I would more than respectfully disagree with you.
This is for our visitors in the gallery. This is a very emotional bill, important discussion. And to be respectful because of the time it needs, I'm going to hold it. And we're going to go to the floor and come back and vote on those last two bills. We cannot rush through something like this. I want to respect people's emotions and views and feelings and history, and we want to do it intelligently. We're going to hold it. Let's go to the floor. Okay, we have to go to the floor. No, he actually wants me on the floor. No, we need to get going to the floor, please. Thank you. Yeah, Jerry.